Hello, everyone. My name is Jennifer Washington, and I am honored to be presenting to you today some research that I've been doing over the past few weeks on diabetes in India. One of the programs that we will be highlighting is the Choleric Diabetes Program Convention, also known as KDPP. It provides a roadmap for how it can be scaled naturally through multi-sectoral collaboration using the Health and All Policies framework. So, an overview of the program, KDPP. Diabetes is a major crisis in India and it's affecting over 77 million people and still rising. KDPP is a community-based peer support intervention that targets adults as high risk developing that are high risk for developing diabetes. Participants attended group sessions led by trained community health volunteers, focusing on diet, exercise, behavioral change, um, and a random controlled trial of KDPP showed that it was effective in improving physical activity, eating habits, and knowledge in cultural relevant cost in a cultural relevant cost efficient way. So here you see a poster, and this is where we're going to discuss the lead organization, the framework, and the stakeholder table. For the lead organization, we would like to utilize the Ministry of Health and Family Welfare. To scale this program nationally, we propose that this organization could be successful because the Ministry of Health oversees public health systems in India and manages national programs for prevention and control of disease diabetes, and as well as other areas of health like cardiovascular disease and stroke. So they already have the infrastructure to support prevention-based programs and a history of working with state level government and NGOs. Their experience and their reach positions them as the most logical leader to use for expanding KDPP in other regions in India. To guide our approach, we recommend using Health in All Policies framework. This model encourages all sectors, not just health, to consider health impacts of their policies. Why does this matter for diabetes? Because diabetes risk is shaped by the environments people live in, like access to healthy foods, safe spaces for exercising, and education. HIAP helps bring health into areas like urban planning, school systems, agriculture, and labor policy. In a country like India, where the social determinants heavily influence disease risk, this framework helps create a structural change needed for support prevention. As for a collaboration for implementation and a stakeholder table, here's how it all comes together. I've mapped out about 6 stakeholder groups for implementing the KDEP, which would include the Ministry of Health, which would find and oversee implementation, local governments, and patriots, which can mobilize community leaders, provide logistic support, public schools, which can include diabetes, education in their curriculum, NGOs, and health promoters who can lead peer training track process. Each sector has a clear role of sharing goals, preventing diabetes, and likely challenges. And limited budgets, and resistance to curriculum change, but through coordination of these groups, we could work together to build a sustainable prevention system. So we have call to action. In closing, this plan supports behavioral change, improve access to community care, and long-term system improvement. With the right leadership and collaboration, India has the tools and evidence to shift from treatment to prevention. So here's the call to action. We urge the Ministry of Health, local partners, and allied sectors to the scale of the KDPP using health in all policies model. The time to invest in the community prevention is now before the epidemic worsens. Thank you. So here we have a discussion prompt. And given the success of the diabetes prevention program at the community level, what are the most critical factors to consider when scaling this intervention in other states or countries with different cultural, economic, and policy context? While you're thinking about this discussion prompt, um, please let me know if you have any questions, and you can reach me at my email, jwashington44@leo.tamuc.edu. Thank you so much for your time and listening to this call to action.